Hi, I'm Dr. David Geier, orthopedic surgeon and sports medicine specialist, and I provide information, education, commentary on injuries and injury treatments and injury prevention in sports and exercise for athletes and active people, probably much like yourself, so that you can stay healthy and perform your best. Now, one of the questions I get so often as I'm preparing to do surgery, or I don't get it and people wish they had asked before surgery, but I get asked, when can I go back to work, or when can I go back to school? We're not talking necessarily about when they're 100% and can get back to play at the same level they were before sports. I mean, that's a whole different discussion. But the idea of when am I good enough to just do the daily activities that I want to do, either around the house, maybe taking care of your kids and your family, or going to work, or going to school. And it's different for different injuries and different surgeries, but you want to know when am I going to be able to do it, and is there a risk that I could do more harm? And so in today's Ask Dr. Geier video, I'm going to talk about that very question as it pertains to a problem that frequently needs surgery, and that's chronic exertional compartment syndrome. Okay, Libby asks, "Hello Dr. Geier, I'm 16 years old and I've suffered from chronic exertional compartment syndrome for 18 months now. After months of unsuccessful physical therapy, I got retested and I opted to undergo the surgery. My surgery's on a Wednesday and I go back to school on Monday. I was wondering, will I be walking by Monday around school, or will I need a wheelchair? And when can I start driving again?" So it's a terrific question, and I think that it's one of those questions that's absolutely worth asking your orthopedic surgeon before any orthopedic surgery, quite honestly. Now, before I answer return to school and return to driving for Libby, let's talk just really briefly about chronic exertional compartment syndrome. This is a problem, or let's at least talk about it with the leg. This is a leg problem, or a cause of leg pain. I usually see it in runners. That's who most often gets it, whether it's joggers and people running marathons, or it could be a soccer player or somebody that runs for very long periods of time. But it's a problem where their leg or legs, a lot of times it's both sides, start to swell over the course of a run, and their calf gets really tight and uncomfortable. And as it goes on, actually, you can start to get numbness and tingling that goes into the feet because of the tightness in the calf. What happens is the muscles in the calf are surrounded by tissue called fascia, and that fascia breaks the muscles up into different compartments, hence compartment syndrome. And that fascia is fairly rigid, so the muscles can swell a little bit, but at a certain point, the muscles swell to the point where the fascia doesn't give anymore, and so because it's tight, that puts a lot of pressure on the nerves and blood vessels in those compartments traveling down the leg. And so you get the swelling and the tightness and the pain in the calf, but you can get the numbness and tingling in the feet, and it's really difficult. Sometimes it'll come on after 30 minutes, but as it progresses, sometimes runners might feel it after 5 minutes or so. And so yes, you can try things like physical therapy. You could even say, hey, I'm going to stop running. But most people that like to run, that's not a long-term option. And so there is a surgical treatment where you go in surgically, you make incisions on the leg. This isn't arthroscopic surgery generally, even though there are ways to do it through little small incisions. But typically we're talking about a few inch incision, sometimes 2 on each leg, depending on what compartments are involved. And you basically release or cut the fascia open, and then you close the skin. So now those muscles can swell, but you eliminate the constriction of the fascia, and basically you eliminate the tightness of the calf with running, and potentially the numbness and tingling. Now, when you do that surgery as an orthopedic surgeon, and this question that Libby asked literally just came up with one of my patients within the last week or two, college student that had surgery, I think it was actually on a Wednesday, went back to school, to college the following Monday. Typically, as orthopedic surgeons, we don't make you non-weight bearing after this surgery. It's not a broken bone, or it's not a ligament that has to incorporate or has to heal or anything like that. So usually you're allowed unrestricted weight bearing. Now, it may be uncomfortable, no question, but you're allowed to do it. So I would say not only can you walk, I don't think you necessarily need crutches or a walker or a wheelchair. It may be uncomfortable, but you can absolutely do it. So you could absolutely go back to work or go back to school within a few days. You're not playing sports, you're not running, but you're able to do something like that. Driving is a little tricky, not just with this surgery, but with any surgery. The key with driving after any sort of lower extremity injury or lower extremity surgery is that you've got to be strong enough to slam on the brakes suddenly. So you've got to be able to basically push your foot down, your ankle down. Plantar flex is the technical term for it, but you've got to be able to slam on the brakes. And so what I usually recommend to people, and generally after this you're able to do it, but what I would do to make sure you're safe is go to like a big shopping center and get in the parking lot when there aren't many people there and practice. Make sure that you can actually slam on the brakes. Or maybe get into your neighborhood early in the morning when there aren't many cars on the road or late at night and try it. Generally though, you can do it pretty quickly. The overall recovery from chronic exertional compartment syndrome and those fasciotomy surgeries can take several months. It takes a while, especially somebody that's had the problem for a long time, for the muscle to kind of feel normal again and go through the progression with physical therapy on return to activities. But the success rate's very good for people that's the problem. They can usually get back to the sports and exercise, again, usually jogging, that they want to do. Now, have you had chronic exertional compartment syndrome, and how long did it take you to recover or to return to work or school? And have you dealt with that with a lot of these orthopedic injuries we see, ACL tears, meniscus tears, rotator cuff tears? Did it affect your ability to do what you needed to do at work or school? And what advice would you have for other people? I'd love to hear your comments. So below this video, leave your experiences or your advice. I'd love to read them and read what you have to say for other people, and I'll try to comment as well. If you know people dealing with this problem with chronic exertional compartment syndrome, I'd really appreciate it if you'd share this video with them, and maybe it could help them make a decision about potentially what they should do. If you like videos and information like this on sports and exercise injuries and injury treatments and injury prevention, subscribe to my video channel. I record 1 or 2 of these videos a week, and I'd love to deliver those directly to you. And last, there's so many resources that I share only by email. So go to my website, drdavidgeier.com. Just enter your name and your email list. It's completely free, and I share a number of resources on the best ways to stay healthy and perform your best. Thank you so much for watching. I hope this video was helpful, especially if you have chronic exertional compartment syndrome. I look forward to seeing you right here next time.